So why is high blood pressure dangerous, and why is high blood pressure called the silent killer? Well, first of all, like I said at the start of the video, blood pressure is symptomless, alright? Most people don't feel any different, so you don't realize you have high blood pressure until maybe 5, 10, 20 years for some people, because they're never checking their blood pressure that often. But here's the main risk factor. Over time, when you have high blood pressure, it can cause small tears in your blood vessels. Those small tears are where then the fat deposits and increases your risk of cardiovascular events. So these cardiovascular events, for example, can cause a stroke where there's a blocked vessel to the brain, heart attack if blood flow to the vessel is obstructed, kidney disease because our kidneys, they weren't designed to withstand all that pressure. So if there's too much pressure going into the kidneys, it will cause damage to them over time. Generally speaking, that damage is irreversible as well. Moving on to blood pressure monitors. How do blood pressure monitors work? How do they calculate your blood pressure? Well, all of our A&D medical blood pressure monitors come with a cuff. This cuff inflates and deflates. So this cuff is then placed on your upper arm. It temporarily stops the blood flow, and then it slowly releases where the sensors detect the blood flow moving through the arteries through tiny vibrations. The monitors then use this data to calculate your systolic and your diastolic blood pressure, and then it presents it on our big clear screens for you to easily see the readings. So now that you've understood how the cuff works and how it inflates and deflates, one thing that is really important I want to discuss that not many people talk about is making sure that your device has cuff leak detection, because believe me, a lot of the blood pressure monitors out there don't have cuff leak detection, and it's not able to really tell if the cuff is inflating or deflating correctly, and if it doesn't have that detection, it's not going to give us accurate blood pressure readings. And this is exactly one of the reasons why I love A&D Medical so much and our devices so much. I don't know if I've mentioned it yet in this video, but at A&D Medical, we invented the blood pressure monitor, the digital home blood pressure monitor, in 1977. So we know a lot about blood pressure monitors. This device in my hand is our A&D Medical Precision Check Pro. It's one of our newer devices. It has a dual sensor fitted inside. So this basically means it's constantly checking for these, and it makes sure that you get the most accurate blood pressure readings. Now remember, since blood pressure fluctuates during the day, which we spoke about, medical providers like myself would usually ask patients to submit 7 days of home blood pressure readings, some done in the morning, some done in the evening, and then submit them. Now, usually what we recommend is when you're taking your blood pressure reading, let's say you're taking your morning readings, you take 3 readings and you take them 1 minute apart, and then you average those readings.